Well, data on hospitalizations in the Austin metro area show the devastating impact of COVID-19 on our healthcare infrastructure. Today, officials report there is a record 586 total hospitalizations and a record 180 COVID-19 patients in the ICU. 114 of those are on ventilators, and the 7-day average of new admissions has hit a record 94. Well, the city of Austin and Travis County have started that process to open the alternate care site at the Austin Convention Center. The facility was set up over the summer during our first major COVID-19 surge, but has not taken any patients. Now health officials say the second surge could overwhelm the system. KXAN's Tahera Rahman spoke with 2 doctors who have been helping local hospitals handle the patients and are now getting ready for the possibility of staffing the field hospital.
You will treat a patient and you don't have the family in the room with them, and it's hard at times just to walk into the room and see them isolated.
Doctors with the Hospital Internists of Texas have been helping local healthcare systems like St. David's and Ascension Seton keep up with COVID-19 patients.
Even the family members of our colleagues, and those ones absolutely stick with you.
Now, their 70 providers have been notified. They may be needed to help staff Austin Travis County's alternate care site.
Essentially, everyone in our group is already signed up and ready to help out.
Saturday, health officials announced they're beginning activation because they, quote, believe it is inevitable that the local healthcare system will soon exceed capacity. It's something these doctors are already witnessing on their rounds with COVID-19 patients.
Initially, we were seeing maybe one a day or one every other day, but within this last week, it was multiple new patients at an increasingly alarming rate.
The city and county are also working with the state to coordinate 24-hour staffing at the site, which would be used for patients who need a lower level of care to help relieve stress on hospitals.
A lot of COVID patients are having to wait in the emergency room, partly because there just aren't beds ready.
Tahera, Rahman, KXAN News.
And the doctors we spoke with tonight say they expect to receive their specific shifts next week. We also told you earlier this week that the Travis County Medical Society put out a call for more physicians to help local hospital staff. Well, today they tell us at least 50 providers have signed up to help provide inpatient care. The group's president says they are now going through an onboarding process.